Okay, so first of all, I will talk later in more detail about conflict of interest. So in most international meetings, you are expected to declare any conflicts of interest. Usually as the second slide, first slide, title slide, second slide, any potential conflicts of interest. And I will explain later about conflicts of interest because this is a very dangerous area. And your handouts have most of these written out, and also in the handout materials there are blanks, and the blanks are shown in later slides in a different color. And if you write in the what is in the different color on the slide, you will have my slide text at the end of the meeting. Now, accepting guest authorship. This is basically being included as an author even though you really were not involved in the research. Maybe somebody who is in the same laboratory. And this is especially the case in Japan, where people have a strong group identity. So we include him and her and him and her. And I have seen case reports with 23 authors for one patient. It's not good. So I will explain later in the uniform requirements, the recommendations for publication. They are getting very strict about who can be an author. And one of the most recent requirements is if your name appears as an author, you must take responsibility, full responsibility. And I made these 10 points because I realized that many of even our senior investigators, chairmen of departments at Tokyo Medical University, did not know about these things. And number 9, especially for students, medical school, hospital personnel, and students are prime targets for reporters, okay? So don't put any material on Facebook, Mixi, or Twitter that you do not want a newspaper reporter to see. I do not use any social media. I was chairman of Department of International Medical Communications, but I refused all LinkedIn, Twitter, etc. Because even if you are very responsible about the content of your site, maybe some other friends put up some funny photographs and it can have a very bad effect on your career. In my second presentation, I will talk more about the guidelines that are available, but you must know that if you are doing, for example, a randomized clinical trial, then you must also consult the guidelines that are available, for example, CONSORT, Consolidated Standards of Reporting Trials, and be sure that you follow them exactly. According to CONSORT, you must have registered your trial before you register the first patient. Okay, so this is your responsibility. And now this is part of the Japanese language. They say due diligence. And it means that you have used reasonable precautions for yourself. And this includes the fact that you ensure your research statistical analysis is appropriate. You make sure that your research and clinical data are accurate and well kept, as well as patient records. Now, the one point that's very important is that this has to be kept until after you retire. And so, agreements to be co-authors, you should have in writing. If I want this gentleman to be a second author on a paper, I will be first author, I should write or send an email to him saying what the paper is, inviting you to be second author, and I must keep your reply in writing. And this can be very, very messy. One situation I know of, the professor and chairman of the department was accused of copying and translating a paper from Japanese and publishing it in English 30 years ago. He's now chairman. His previous chairman, and in the time of the chairman before him, he's dead now, okay? And what happened was 30 years ago, very few people could write in English in Japan. So it was his case. So he wrote in Japanese. And then the chairman said, okay, we want to publish in English, so your English is no good. So your English is good, so you write it in English, okay? But no record. And now somebody wants to attack and damage the career of that chairman. So they produced two papers. One is in 1977 in Japanese. One is 1979 in English. Same photographs, same text. One is Japanese, one is English. Oh, why is this? Well, the present chairman, his chairman said, you write it in English. Yes. So he did, but no records. So now it looks like he stole, he plagiarized, he copied. So you have to be very careful to keep all correspondence with journals, all agreements with co-authors, patient records, and research and clinical data. This is all part of reasonable diligence. So keeping lab books is important. Usually it's more difficult for clinicians because they're more busy and they do not keep as detailed records as preclinical investigators, but it is important. Now, ghostwriting, this is a writer who writes the paper or most of the paper, but who does not appear, right? Now, many companies in the United States use ghostwriters, okay? They want to get their drug publicized, so they get a ghostwriter, they give the data to the ghostwriter and said, please write it. And so he writes it. And then they take it to Dr. So-and-so, and they say, look, could you just revise this paper and submit it? And you submit it in your name, and later we ask to see your records. If you remember, the records must be kept until after you retire, and you don't have the records. Oh, so when was the work done? You're destroyed, because you will be considered a liar, and in science, truth is everything. So that is not to say that you must ignore help. If somebody translated, mention their name or the company, or edited. All the papers I or my department edit have an acknowledgement. The authors are indebted to so-and-so for editing the English manuscript. And I will touch on it later, but there's a somewhat similar culture in Korea and Japan, I believe, where it's considered normal to put the professor's name as the last author. But in the West, just because the professor got the money or the funding does not mean he has the right for authorship. But that can be a cultural problem, so it's a little bit difficult. Now, fabrication of data, we all know, is not good, to make up data. But what does making up data mean? Supposing you have an immunoblot photograph that it's a little fuzzy, it's not so clear, and you want to show it more clearly. So you do photo enhancement. I mean, it's not wrong, is it? But it is wrong, because it is data and you are changing it. So in such cases, when you submit the paper, you can enhance it if you want, but you must also submit the original, non-enhanced photograph and say, we used image enhancement for figure 5 to make it easier for the reader to understand. We also include figure 5 before image enhancement. And then it's up to the editor to decide, does he want the original or the more clear enhanced image? But the important thing is, on your computer, you have an email sent saying, we have enhanced the image, and it's up to you to choose. And this was a very serious case in Britain a couple of years ago. This guy, Wakefield, he received 60 million yen, that's 600 million won, beforehand to create data showing that children who were vaccinated for MMR had increased risk of autism. And he published it in the Lancet. It was a big paper, a lot of interest. And later it was found out that a company of lawyers had asked him to create this paper so that perhaps parents of children with autism who had received the vaccination would sue. So they would go to ABC legal company and say, oh yes, Dr. Wakefield showed that, autism can be, the risk is increased by the MMR vaccine, so let's sue the MMR vaccine manufacturers. So eventually he was found out, and he will never be able to practice medicine again in Europe. Now, plagiarism, actually, just about an hour ago, I was looking through my dictionary. I was wondering, plagiarism, what does the word plagiarism come from? It comes from kidnapping. Kidnapping is to take a hostage, to grab somebody and use them for your own purposes. And it's a type of theft. Now, you have to remember that your specialty, it's a very small field. I mean, the number of top people are very small. And eventually, people will know if you have used a sentence from another publication. And if people think that you plagiarize text, they'll also think that you steal data. Now, the problem is that if your native language is not English, and if your native language is not an Indo-European language, then you have great trouble in expressing yourself in idiomatic, attractive English. So people in Hungary, Turkey, China, Korea, Japan, they face a lot. The science level is very high, but the number of publications is not so good. I remember when before I came to Japan, I used to work part-time in the medical library of my university. No papers from Asia. None from China, none from Korea, none from Japan. So I thought, maybe they're very backward in Asia. And then I came to Japan, and I saw the level, mainly in lung cancer, was so high. And I was angry that so much information was being lost. And the patients are cooperating, hoping the data they provide can do good for some other patients. You have a duty to publish, but it's very hard. Just remember the number 15. Change a word every 15 words and it's not the same, okay? It can be changing a conjunction or leaving out a the. I'm not saying copy, but sometimes there are some very nice phrases which I will introduce in a later lecture on elegant phrases from the New England Journal and Nature. And you can learn a lot, but try to pick up just phrases, not whole sentences, because people will remember sentences. Now, most duplicate publication is illegal, but there is also acceptable secondary publication, and I'll talk more about that later in my second presentation. And this is very important for people who have already published in another language that is not read by people in Europe or North America. And until this year, it used to be called the Uniform Requirements. They had this is the uniform and regulations. And it is on this site, www.dronbun.jp. Dronbun is Nunmun in Korean. And it is mainly in Japanese and English. It's been transferred to English quite a lot. It's a very big site that mainly I and my staff have made, and it's free. You don't even need to register. No name. And it's the best site, and we get about 25,000 hits per month. Now, The number one dangerous item, I think, is not disclosing potential conflicts of interest. About 7 years ago, in Seoul at COEX, you had the International Association for the Study of Lung Cancer meeting. And at that meeting, the organizers had a booklet for all the presenters to list any commercial affiliations. And the Americans, one guy would have 8 companies that he was related to. Japan, 0. Korea, very few. But, I mean, these are people who are running a randomized clinical trial. It costs a huge amount of money, millions of dollars. Do you think they're paying out of their own pocket? Impossible. Of course you have conflicts of interest. If you don't have a conflict of interest, there's something wrong. The problem is if you hide it. So, as I said here, it's almost completely opposite in East and West. It is not a problem to have a conflict of interest. All top researchers do have it, but it's a fatal problem if you have a conflict of interest that you do not disclose. So, if you have any doubts, check with the editor of the journal. For example, you're doing a paper on drug A produced by company Z. And you have very little affiliation with company Z, but you're a consultant for company X, which produces drug B. If you want, in your cover letter, you can state that to the editor, asking if it should be disclosed as a conflict of interest. So, as I said, openness and keeping the records is very important. And recently, the Committee on Publishing Ethics, COPE, the flowcharts are on this site, and you can see the kind of problems, ethical problems that arise. And ethical problems are becoming more and more of a problem in medical publishing. The AMA Manual of Style, 9th edition, was 600 pages. The AMA Manual of Style, 10th edition, was about 1,100 pages. And about 400 pages was about ethical problems. So you can see it's worldwide, it's a very important problem. And if you make any of these mistakes, all you've done, 8 years of medical school and residency, 80 hours a week, 50 weeks, 30 years, can be reduced to less than 0, because once your scientific reputation is gone, it will not come back.